I am the Director of Medical Excellence, and in this role I focus on creating resources for our hospitals to improve patient outcome as well as patient safety. Here at Ethos, we've created a patient safety event reporting system for our hospitals to utilize using a platform that we actually already have in place called Origami. And what that is unfortunately accidents happen, mistakes are made, and so what our focus is how are we going to learn from those mistakes and improve to reduce the chances of the same mistakes happening again, and make sure that we're training our teams and educating them so that they feel better prepared and empowered, really, because there's a lot of guilt that can be associated when a mistake is made. And by using a platform to analyze the event, so what the patient safety event platform does is it enables the hospitals to report incidents that occur. So if a nurse accidentally gives a higher dose than they were instructed to give, they can actually report that. The information goes to a hospital leader, and they'll really do an investigation, a look into what happened, what made that, contributed to that error happening. Was it not having enough staff? Does that nurse need additional training? Have we best prepared them to be in that role? And so having a platform, a centralized database where the hospital leaders can look at it, we can see, is this a one-off event, just a bad luck, if you will, or is this actually a real problem that warrants new training, new education, or even different workflows in our hospitals? It's really important for all hospital and employees to understand that this isn't a system about getting people in trouble. This is really about supporting each other and learning from mistakes that happen. And sharing is really how we learn and improve, which is the ultimate goal of this project, is how do we get better? How do we make our outcomes better for our patients? And it really shows that we're trying to use evidence-based medicine as well as always learning and always improving on ourselves and the processes that we have at the hospitals. Some hospitals, some leaders have asked why they would want to use this centralized platform instead of a lot of hospitals have individual spreadsheets or smart sheets that they keep at their location. This is helping us get data, and so again, this isn't data to get people in trouble, or there's absolutely zero judgment, but what we do want to do is, if you think about the power of information, of collecting that from our network of about 145 hospitals, we can hopefully pick up on incidences such as equipment that maybe we really shouldn't continue to invest in. Could we potentially see a rise in a problem with a medication even before the manufacturer alerts us to it? It can actually also help us work with clinical learning and development. So if we're seeing lots of problems, say with fluid administration, what education can we develop and give to the hospital so that everybody can share that with their team?